Joining us now to talk about all things masks when it comes to preventing coronavirus, Dr. Dean Winslow. He's an infectious disease specialist with Stanford. Thanks for joining us, Doctor.
Well, thank you for having me.
Let's start off with the new national standards that have just been unveiled for masks. What are we looking at?
Yeah, so again, I think it's a real positive thing. The ASTM, the American Society for Testing the Materials, has this proud history going back more than 120 years when they developed standards for the strength of steel rather, used in rails for railroads. And again, apparently they have more than 12,000 standards that look at all kinds of materials that we probably take for granted every day. So again, having an ASTM standard for masks is, I think, very, very positive.
And what are the standards?
Yeah, so again, I'm sure they're very technical, but they have to do with the sort of the tightness of the weave of the material and the durability of the material and that sort of thing. And from what I was able to find, that basically these masks have to demonstrate at least some degree of efficiency in filtering out small particle aerosols, which we now realize is probably the major way that the virus is transmitted indoors.
So, of course, we've heard all along that these N95 masks are the most efficient way to be able to stop coronavirus from spreading. Not always the most practical, though, when it comes to cost and availability, frankly. Do these standards give us other options?
They absolutely do. And one thing, that I always point out as someone, who has to wear a N95 mask during the day when I see patients with COVID is just that they are incredibly uncomfortable. And it's really, in my opinion, not very practical to, wear one all day long. Again, I can't wait to get out of the patient's room and be able just to put my regular procedure mask on. But again, the ASTM standards, I think, should really give Americans a big degree of comfort that the particularly cloth masks that they may be wearing, meet these standards and will work.
Okay, so what are the minimums when it comes to fit for what is going to be a workable mask? I know you mentioned the N95s being uncomfortable. To me, that's one of the most uncomfortable things is that it's just so very tight, but that's something you kind of need in a mask.
Yeah, exactly. And one of the nice things, though, about at least many of the cloth masks that I've seen that hopefully very soon will be meeting these standards is that they actually form fit to the face very, very well. And one of the reasons that the CDC, I think, recently came out with their recommendations for people to consider wearing two masks, that is a cloth mask over top of, let's say, a disposable surgical procedure mask, is what that does is that it just ensures a much tighter fit. I know for a fact that sometimes when I wear just a plain surgical procedure mask, if I don't have particularly the bridge over the nose, secured real tightly, my glasses will fog up. So I know for a fact that I don't have a really good seal. And so again, wearing a just a snugly fitting but not uncomfortable cloth mask is really helps take care of that potential problem.
Well, that's one of the complaints that a lot of people have about wearing masks is the glasses fogging up, either your normal glasses or your sunglasses. So you're saying that should be a hint that you should get a different mask.
Absolutely, or adjust the fit of it. So again, I think these ASTM standards really go a long way towards doing that.
Okay, very good. We know about the N95s and now hearing about these KN95s. That is more it's easier to get the KN95s online. What's the difference?
Yeah, so my understanding is the KN95 masks don't necessarily pass quite the high rigorous standards that the N95 masks do in terms of being able to filter out small particles. However, I think most of them are still, pretty good masks if you do enough research to make sure that they're sourced from a reputable source. I think that's one of the keys. Is one of the concerns has been is that some of the commercially available KN95 masks may not meet those standards. So again, I think it behooves people to do a little bit of research and look at what sources are recommended and approved.
Yeah. Is there any other way to tell if it's the real deal?
Yeah, I think again, most of us don't have, the technical equipment to actually, look at the efficiency of the mask per se. But I think, getting an N95 or a KN95 mask, or even one of the reusable cloth masks, which is really what I recommend, for people to wear outside of, say a hospital setting. They definitely get one that has the ASTM standards label on it. I think this is just a wonderful bit of progress right now.
Okay, so that will companies be forced to follow these standards, or will they just sort of have the badge of honor of having the label that they've gone ahead and used them themselves?
Yeah, it's a little unclear to me, but my sense is that this is a voluntary standard, as it generally is for most other products. But again, it's sort of like the underwriter's laboratory label, that goes on to a lot of electronic devices. I think it really, though, does and should, give the American public at least some degree of certainty that they're getting a product that'll do what it's supposed to do. So again, I think it would be a competitive advantage, certainly, for companies to have ASTM label basically on their product, that it meets those standards.
So if a consumer was looking for something like that, it would be positive reinforcement, at least for the company, that is something that would make their product more marketable.
Yes, ma'am, absolutely.
Now, when it comes to disposable masks, what should we be looking for right now? And how long can we use these things?
Yeah. So, a great question. I just personally, take for granted that the hospital, where I work at Stanford is buying approved surgical procedure masks. But again, I think the answer about how long you can safely use a mask is probably variable depending on what you're doing. And I think certainly you could, if you're not, actively exercising or sweating or somehow soiling the mask, you could probably use, a well-fitting disposable mask for a couple of days. But most of us generally swap them out, after a day.
Now, when you talk about, sweating or makeup or whatever we have on it, that would be, I suppose, unsanitary to continue to wear the same mask. But coronavirus wise, is it something where the virus could be trapped in the mask at some point that you would need to jettison it?
Well, I wouldn't worry about that as much. But again, the concern would be that if the mask is basically blocked up, is that essentially what happens then is that the air would exhale around the mask outside. I think that would be the major concern. And of course, we also know, though, that the masks, in addition to protecting others from infection or from us generating aerosols containing virus, if we happen to be infected and not have symptoms, is that we do really know now, there's good data to support the fact that the masks provide a moderate to large degree of protection for the wearer as well. So again, I think that's another reason just to emphasize that you should have a well-fitting mask on. And again, if it's a disposable mask, certainly, swapping it out if it, is looking a little tired.
Okay, good advice, since it sounds like we're probably going to be wearing masks for what, another year? Is that what we're looking at here?
Some people are predicting that. And again, it's, a little bit of a pain to do, but I think it's probably the most important thing that we're doing to reduce the transmission of the virus, in addition to, of course, immunizing our population with the vaccine against COVID-19. So my mind, those are the two most important things. And then just the third bit of unsolicited advice is that, unfortunately, going to or attending crowded indoor events, such as indoor dining and bars and concerts and all the things that most of us absolutely love doing, unfortunately, those are going to still remain pretty high risk activities for the foreseeable future. So, this, I think, is the new normal, at least for the next several months.
Okay. Dr. Dean Winslow with Stanford Health Care, thanks for all your insight.
Thank you. Thanks for the good work you're doing.